Mr. Chairman, colleagues, coffee is one of the most popular beverages worldwide, consumed in a variety of ways. Over the past few decades, several studies have been conducted to investigate the effect of coffee on the cardiovascular system and arterial hypertension. The composition of coffee is complex and depends on a number of factors, including the type, production, and method of preparation. It contains approximately 1,000 chemical substances, many of which are biologically active. Caffeine is one example of this compound, and its concentration varies according to the method of preparation employed. The difference in the content of caffeine can be responsible for the variety of effects on health and organ system. However, other bioactive components in coffees also appear to play a role. Results of different studies indicate that regular, moderate coffee intake has positive effect on the nervous system, cardiovascular and digestive system, as well as on kidney function. A recent study has indicated that regular consumption of 2 or more cups of coffee a day may reduce the risk of fatal and unfatal cardiovascular disease, type 2 diabetes, and endometrial melanoma and non-melanoma skin cancer. Conversely, the effect of coffee intake on blood pressure and the risk of arterial hypertension remain controversial. The result of a presumed analysis conducted by Sana and colleagues provide support for the hypothesis that coffee consumption was associated with higher blood pressure. Systolic and diastolic blood pressure were observed to increase by 2.4 and 1.2 millimeter of mercury, respectively, in subjects who consumed coffee compared to those who did not. Additionally, a positive correlation was seen between the number of cup of coffee and the change in systolic blood pressure. In contrast, the findings of another meta-analysis by Delia do not support this conclusion. The blood pressure values of subjects who drink 3 or more cups of coffee per day have been found to be lower than those of non-drinkers. This suggests that the risk of hypertension may be lower in coffee consumers than in non-consumers. Therefore, many questions related to the association between coffee and blood pressure remain unaddressed. First, is there a different effect of coffee consumption on blood pressure between habitual drinkers and no coffee drinkers? Second, does coffee consumption have any effect on blood pressure values in and out of office? This information is clinically relevant because of the greater prognostic impact of 24-hour blood pressure compared to clinical blood pressure. And does coffee consumption contribute to the development of arterial hypertension? And finally, does coffee consumption have an impact on arterial stiffness, which is correlate with the pathophysiological mechanism of different cardiovascular disease, in particular hypertension? In the next slide, I will try to answer this question. In a study published by Robertson and colleagues, it was observed that coffee intake was associated with an acute increase in blood pressure in non-drinkers, panel B. However, in habitual coffee drinkers, the long-term effect of coffee on blood pressure were found to be minimal or absent. The acute effects of coffee are transient, and with regular intake, tolerance develops to the hemodynamic and humoral effect of caffeine. Indeed, acute administration of caffeine has been demonstrated to induce an increase in plasma renin activity and urine and plasma catecholamines, which attenuates and disappears with chronic consumption. The study of Sudano showed that coffee induced a significant increase in systolic and diastolic blood pressure and mass sympathetic nerve activity in non-habitual coffee drinkers, whereas in habitual coffee drinkers, blood pressure did not change despite a similar increase in mass sympathetic nerve activity. No additional increase in sympathetic nerve activity was observed during mental stress in both groups. It is worth of note that decaffeinated coffee also increases blood pressure and heart rate in non-habitual coffee drinkers. This suggests that other substances than caffeine are responsible for the stimulating effect of coffee on cardiovascular system. Further evidence of the positive effect of coffee on cardiovascular health can be found in a sub-analysis of the Brisighella heart study. Subjects who drink coffee regularly exhibit lower peripheral blood pressure values as well as central aortic pressure values, which represent the pressure to which vital organs and vessels developing atherosclerosis are exposed. Summarizing this data, it's likely that also caffeine could increase blood pressure levels, particularly in non-habitual coffee drinkers. The amount of bioactive coffee compounds counterbalances this effect, resulting in a final effect on blood pressure that is neutral to positive for habitual consumers. As previously mentioned, the second unaddressed question regarding the effect of coffee on in and out of office blood pressure. A recent cross-sectional analysis of the Pamela studies showed that systolic blood pressure values clinics show that systolic blood pressure values are significantly lower in coffee drinkers, orange and yellow histogram, as compared to non-drinkers, green histograms. However, this is not the case for 24-hour and home blood pressure, which are almost similar in the three groups. Similar findings are observed for diastolic blood pressure, with the exception for diastolic 24-hour blood pressure. These data indicate that chronic coffee consumption does not appear to have a significant effect on blood pressure, both when blood pressure is assessed in the office and over a 24-hour period or at patient's home. It should be noted that the heart rate values in coffee and non-coffee drinkers were superimposable both in office, 24-hour, and home, confirming that the sympathetic activation reported following acute coffee consumption is attenuated or absent in chronic coffee consumption. Further prospective data has been obtained on the association between habitual coffee consumption and office, home, and ambulatory blood pressure. The Pamela study provides evidence that the habitual coffee consumption is associated with a neutral effect on in-office and out-of-office blood pressure at entry study and after 10 years follow-up. When we analyze the 24-hour blood pressure variabilities, a parameter closely related to subclinical organ damage and cardiovascular events, we found that 24-hour systolic and diastolic blood pressure variabilities, both when expressed as standard deviation of the average values, lower panel, and as a residual variability, upper panel, were virtually superimposable in non-habitual and habitual coffee drinkers at the study entry and after 10-year follow-up. Another relevant question regarding the relationship between coffee consumption and the risk of developing hypertension. The finding of this study indicated that coffee consumption is associated with a slight elevation in blood pressure. However, it appears that coffee plays a relatively minor role in the development of hypertension. And in the Pamela study, the incidence left panel and the adjusted risk right panel of new onset office, home, and 24-hour hypertension were found to be similar in coffee and non-coffee drinkers after 10 years of follow-up. Finally, limited information is available on the relationship between coffee consumption and arterial stiffness, which play a relevant role in cardiovascular pathophysiology, particularly in hypertension. In a sub-analysis of the Pamela study, we found that chronic coffee consumption exerts a neutral impact on arterial stiffness. No significant difference were observed when data were analyzed according to gender, upper panel, or antipartisan treatment, present or absence of antipartisan treatment, lower panel. The neutral vascular impact of coffee may favor the absence of any significant blood pressure effect of habitual coffee intake. And we can postulate that this may depend on a balance between the oxidative stress-mediated vasoprotective effects of coffee and its vasoconstrictive effects mediated by sympathetic and angiotensin II. In conclusion, coffee is a very popular beverage consumed and is composed of a variety of substances, many of which are potentially biologically active. The main active substance for blood pressure increase seems to be caffeine, but its adverse effect may be mitigated by other substances. The impact of coffee on blood pressure is minimal or neutral in chronic users, even when blood pressure is assessed out of office. And we know that coffee is not related to the development of new onset hypertension, and that probably various mechanisms are involved in the relationship between coffee and blood pressure. We also know that the protective role of coffee on health is extended to the non-cardiovascular system. So a moderate consumption is advised, about 3 or 4 cups of coffee a day. And this approach is in line with the most recent consensus document on the prevention of cardiovascular disease. Thank you for your attention.